From challenges to champions, we are here talking to those who are on the front lines in fighting sickle cell disease. And I'm excited to have Dr. Jason Payne. He is a professor at the illustrious Morehouse. Need I say any more? How are you, doctor?
I'm doing fantastic. Thank you for having me.
Absolutely. I want to start off with this. At one point, there were 19 Black medical schools, and now we are down to 4. I really want people to understand the importance of why even funding for Black medical schools is important and the work that you bring.
Absolutely. So I'm a product of one of those medical schools, actually. So I graduated from Morehouse School of Medicine in 2013, and now I've since come back and I'm now a professor at Morehouse School of Medicine, and where I helped actually train the next generation of these upcoming doctors. And so without historically Black colleges, without medical schools, I wouldn't be here right here, today. I wouldn't have had the opportunity to be a doctor. And so HBCUs are really important because they really do see beyond the traditional candidate when it comes to applying for medical schools. And they really see to the person and understand the mission behind what we want to accomplish as HBCU medical schools. I love Morehouse School of Medicine so much so that I came back because our mission is to actually is to serve the underserved. And so that's why I went there for medical school. That's why I came back to Atlanta to help serve my community.
So as we sit here, talking about sickle cell, you're here on a panel that Pfizer has put together. What is a message that you want people to know when we're talking about this fight against sickle cell disease?
Yeah, so I want everyone out there to be aware of what sickle cell disease is, right? It is a disease that is more common than what we think about. Everyone has blood, right? But what's inside of our blood is what defines someone as having sickle cell disease. So you may not know who has it just by looking at them, right? And so it's really important to me because being one of few minority physicians, our patients want doctors that look like them, and they really are craving that. And they want to find providers that look like them and understand where they're coming from. And so I'm really privileged to, be able to do what I do. And I just want everyone to just realize how important it is to really fund programs that help create the next generation of doctors.
Last question. What is the impact that you want to leave in this field? I know I'm not thinking about legacy, but as you do your work day to day, what is this legacy that you want to leave in this field?
I think as a doctor, you do want to leave a legacy, right? So being a pediatrician, my whole goal is to create functional adults. And so I treat kids who have sickle cell disease. And so I want, my legacy is my patients ultimately, right? I don't know what these kids can do. I don't know their potential, but they could be the next president, they could be the next doctor. And so that is my legacy. And so I want to give every kid that opportunity, whether they have sickle cell or not.
Thank you so much for the work that you do at Morehouse. Thank you for, the work that you do as a pediatrician. And I'm sure that the legacy that you leave will be amazing and great. And I'm just glad to have met you, Dr. Payne. Thank you very much.